Today on the show, the benefit of connecting with cancer care centers across the globe. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. We're back with the third episode of our international series, featuring the clinicians who joined the first ever global panel discussion at ACCC's 41st National Oncology Conference. Dr. Theodora Karnakis joins us from Brazil.
Brazil, it's a very large country with a very significant economic disparities. And in our health system, 70% of Brazilian depends of the public health system, and 30% depends use the private insurance. So with the aging populations, we have a lot of increase of the incidence of cancer in our country. And for you have an idea, between 2020 and 2040, we expect an increase of 61% of new cases of cancer and 81% of deaths of cancer.
What does the healthcare landscape look like in Brazil?
Recently, a publication discussing our health systems is not the same in our country. The public health system, it's different. It depends where you are in our country. We will receive different kinds of treatment. It's because the allocations of the resources. So that was very important publications who makes the government move on a new policy about cancer in our country that was published last year. The main of these policies is that we have to secure for our populations the access to the treatment, and the other thing, quality of life in the treatment, and the campaigns in prevention.
How is connecting with other cancer providers from around the world helpful to you in your practice?
It's very interesting to recognize that in each part of the world, we have different situations, but the same situations in different ways. It's quite difficult to imagine that our reality will be the same in the other countries because it's completely different. But at the same time, we learn a lot and we find things that bring to us ideas to propose in our country. I think it's very interesting talk and listen. Sometimes I feel, I don't know, this is so different from me, from my country and what I can do. But sometimes I can tell, I'm very proud about my health system in my country. But it's very hard, really hard to attend all these populations. There is a lot of people studying how to solve these problems. I think education is the most important. Education not just for medical staffs or health professionals, with the population too.
Thank you, Dr. Karnakis. Our next episode in this series comes to you from Egypt. Make sure to subscribe so you don't miss it. Thank you for listening. Until next time, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.